morning, good morning. My name is Rick Noda. I am the founder of T3 Body and your host for T3 Talks, where we tighten, tactical, and transition. Well, again, you guys, day 2, I'm here in beautiful Encinitas, California, Encinitas Family Care with my good friend, Dr. Perry Sexton. And we've decided with my producer to call this the truth about inflammation. Or maybe we might call it the chronic diaries of information. We're still figuring it out right there. But Dr. Sexton, you know, in the previous video, we kind of alluded a little bit to about inflammation and why it's such a badass or pain in the ass. Can you tell a little bit more about maybe a story or something where, like, the difference between anti-inflammatories and maybe antioxidants? There's a lot of confusion out there.
Good questions. So, inflammation gets to some extent a bad rap, but maybe not even a bad enough rap from this. It's a very natural thing going on. It is a process that our body has to try and correct problems that it sees. It has evolved over hundreds of millions of years to be able to fight infections with this inflammation, to repair injuries that your body gets. All of this stuff requires inflammation, and it is a natural process that's going on in your body. However, it has some downsides. And so, when you get injuries and your body is swelling up because you've sprained an ankle or sprained a shoulder or something like this, your body's sending a bunch of blood cells there trying to, break down the parts of the tissue that have been destroyed and then rebuild them up in a hopefully constructive way.
Nice.
Here's the thing. Whenever you get this inflammation going on chronically, it can have some side effects. Some people have these side effects more so than others, but when I'm talking about these side effects, chronic inflammation is going to lead to things like degeneration of the cartilage in those joints that's there. When you hear people saying, oh, my doctor says I have bone-on-bone arthritis, this is not because their cartilage was less to start with or because their activity or because they are older than somebody else. What's happened is that they have allowed the inflammation to go on, and while it has been trying to fix the microscopic injuries in that joint, it's not fixing it like a dentist fixes a cavity by filling in all of those valleys.
Yeah.
What it's doing is it's whittling away all the cartilage that's left, making it such that there's a little bit less. And in some people, there is an additional process that goes on where it causes some additional scarring to go on.
Yep.
Now, whenever your skin scars, it does it with collagen, something that's flexible like the skin itself. However, when internal things like ligaments, tendons, bones, cartilage, whenever they scar, they're doing it with calcium. And so if you hear people say, oh, I've got bone spurs, I've got heel spurs, I've got calcium deposits on my rotator cuff that the surgeon's going to go out and root out, this is going to be something that you've got to try and take care of.
Right.
If that person, when they had gotten the original injury and then when they had gotten the recurring injuries, had been really aggressive with anti-inflammatory medicines, ibuprofen, naproxen, these are some of the mainstays of it. If they had been aggressive with those kinds of medications, there's a good chance that they could have limited the amount of calcium deposit. They could have minimized the side effects that took place as that inflammation was going on. They could have sped up the healing process and then gotten back into their training regimen with a little bit less of a detriment going on.
Yep.
So those are things to think about whenever we're talking about this kind of specific inflammation. Your body has a specific goal of trying to repair that muscle or trying to fight that infection that you've got going on, whether we're talking about strep throat or we're talking about a virus that's inside your body causing you these cold symptoms. Your body is trying to accomplish something specific. We just may want to limit that a little bit to try and limit the side effects that may go along with that.
Correct.
Now, there's another thing that's getting a lot of press out there. Everybody's talking about, I've got to take my turmeric or my curcumin or back 5 years ago, they were talking about superfoods and drink your blueberry juice, acai, this, that, and the other thing. Well, all of these things that they're talking about are actually sort of the same thing. And the reason that this came about is because cardiologists have learned that when we are starting to get things like cholesterol plaques forming in our hearts, it's not just a simple process of having high cholesterol plugging up the arteries like you've got stuff plugging up the pipes in your plumbing. What's going on there is that while the cholesterol is floating around in your bloodstream, it needs a point of friction in order to stick to the blood vessels, and that friction is caused by free radicals damaging the sides of the blood vessels in there, making a point of friction such that cholesterol that's in your body, my body, everybody's body, now getting a chance to stick there and plug up those arteries, now like that sink that won't drain for you. The thing of it is that the antioxidants that they're talking about don't do anything for these colds. They don't do anything for the muscles that are in there. And so people are getting a little bit misled by the marketing that's being done. So that's why I want you to sort of think of things like specific inflammation where you're using things like naproxen or ibuprofen if you're able to take those kind of medications. Versus if we're going to be doing something to try and reduce the general inflammation due to oxidation going on. That's where drinking, cold pressed juices or things like that can be good. Eating more vegetables, green vegetables, any vegetable with a color. All of those colors that you see in those vegetables are caused by molecules that are in there that are going to act like Kevlar against these free radicals. Yep. And so if you can get more of those inside your body in one way or another, that's a great way to protect yourself against these kinds of things. But don't be fooled into thinking that all of these things should be, having tons of money spent on them, because you don't necessarily need to do that to get the same kind of benefit for it. So that's the caveat I make.
It's really nice because Doc, and I've been, me and Doc worked together for a long time, so the stories about to say I've probably heard about a billion times, all right? But you drive the point home with the 9-year-old boy, because that's a huge part. I hear that all the time, where people are like, well, something happened and then it went away. Yeah. But it's like, he'll tell the story, it's great. Like I said, I've heard it a bunch of times, being in the room, doing the notes and stuff. But I really think that drives it home really well. Can you tell them about, like the little boy stubs his toe and he forgets about it, and it comes home and all of a sudden, You know
what? I can't even remember that
So
story.
I'll tell you. So I heard it so many times. So Doc talks about this in a good way. So what Doc says is a little boy runs out the house, stubs his toe. And when he stubs his toe, he goes out and plays all day. And as he plays all day, he doesn't even think about his toe once whatsoever. Then he comes home, he sits on the couch, Mommy, my toe hurts. He didn't put the crying in there. I added that in there for color. Mommy, my toe hurts. And
I've learned to do the crying since he left. I got to get my drama level up.
The drama. And he goes, What happened? Did you just hurt? She goes, no, this morning. This morning? Like, why didn't you come to me this morning? Well, because I was this, and adrenaline got him out because he wanted to go play. The inflammation protected the toe there, but then as his adrenaline started to drop, the toe became more painful. So now he was looking for the treatment. So I hear a lot of times, again, when someone goes, well, something was, it hurt me and then it went away. That doesn't necessarily mean that it went away. It means that chronic inflammation system kind of protected itself just for you to do your task. As a Marine, that we use Motrin all the time for that. And then after that, you're able to then say, okay, how am I going to treat it? And that was a really nice way to kind of show people that listening to your body can help. But sometimes we don't listen. We press the overdrive. We go past that. And then sometimes that treatment then requires surgery. Because if you would have listened to your body, and you would have done the treatment, you could avoid something that would have been a little bit more costly. Now, I do want to do a disclaimer here, you guys. When me and Doc talk about Motrin, we talk about medication. I hate to have to do this, but disclaimer, please consult your physician and primary care doctor for any sort of use of any medication, blah, 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 blah. There'll probably be a big disclaimer underneath here about all this, because again, as a service here, Doc and I want to give you a service as nurse and physician of a resource, a starting point. Then you go to your doctor and really come see us. No, but that's not, a remote, let's see a product placement again. But really then you can go to your doctor and say, hey, listen, I tried this treatment and it didn't work. What do you got for me next? And that's really a great way to do that. Now, Doc, any other story you can think of that might kind of, just reassure a patient you might have known that really kind of had an aha moment?
Boy, whenever we're talking about inflammation, I have seen so many patients where they come in and, again, I hit back on the situations where patients are looking for the relief that they've gotten with something before. And so they will talk to me, I need this antibiotic for my cold. And once you put those two statements together, you should back up and say, okay, wait. I just forgot that the colds are caused by a virus. That is not something where we need antibiotics going. And the antibiotic resistance is something that we really want to try and avoid. But I see over and over again when patients go into urgent care centers that they find themselves getting less than sufficient care. They're going there and the doctor takes something like 5 minutes to see them, if taking that, and just says, okay, well, you've got this. Here, I will send you out with something. You've got something in your hands, and it makes the patient feel validated. Yep. I want patients to feel validated by the education, by the understanding that they get. That's going to be the thing that is going to help them get through this type of thing. So when you are looking to a doctor and he gives you an antibiotic for this, say, what do you think the infection is and how do you think that this antibiotic is going to treat it? Maybe he is giving you that medication because he thinks you want it. Sometimes we doctors are feeling the urge to try and placate
right now, Seven.
So whenever we get problems with inflammation and colds and things like that, and you go into your doctor and he is giving you antibiotics, say, wait, what is this going to actually do to treat the infection? If this is a virus, is this actually going to work? Your doctor may be giving you things because he thinks that you want it. Yeah. Sometimes patients come into me and their statements will be, I've been given this before and I know that it works for me. Your antibiotics are not treating you, they're treating the infection. And so some of the experiences you have may be deceiving you, and go to your doctors for advice as opposed to for prescriptions.
Thank you. Well said, Doc. And you know, I can remember, like, I'd be doing the triage, and I'm triaging the patient, and they're telling me that, like, oh, I know exactly what I need. I'm gonna do this, and I kind of like have a smile on my face, and I would instant message Doc before you come in the room, going, oh, we've got some education to go here. We've got someone to educate, because again, here's what I'll tell you guys is this: diamond in the rough. Diamond in the rough. What I mean by that is it is very courageous to be able to say what we want to say. The reason he opened his own practice, the reason I have my own practice, is to talk about the 5,000-pound elephant in the room. No one likes to be a yeah man, and that is something where there's a plenty out there. So it's nice to empower that courageousness of this doctor and me as a nurse to say no. No bueno, that's not what you need. And that's a way to actually stop a problem that's happening in current modern medicine, is shut the fuck up, take your medicine, and leave. And that's not what we do here. And I don't swear a whole lot on these things, so you could tell I get upset when that happens. So you guys, thanks, Dr. Sexton. Again, we're here all week, and this is, again, a segment that we're going to have every 4 weeks here at beautiful Encinitas Family Care. So when I say our motivation inspires you to be better, see you in my next broadcast. T3 Body, you guys, is a company and a fitness company that really talks about the complete athlete. When I talk about our motivation inspires you to be better, all right, as a non-for-profit that supports military veterans that suffer from mental health issues, I really enjoy the support you guys are giving me here on YouTube. But again, I am seeking clients on my T3 Body. So if you go ahead and take a look at my website, understand that the intimacy of getting to know you starts with just 30 minutes motivation. So you go on there, you sign up for one of those, you get a one-on-one remote talk with me just like this. Then I encourage you to go and look at one of my training plans, download a 4 to 8 week training plan, and really kind of just test your body, test yourself, and just really start to get yourself ready to then do the next thing, is where you get 4 or 5 of your friends together and dare yourself to be better, where there you have a little bit more of my information along with my training plan. You get some remote sessions with me regardless of where you're at. You notice if you're watching me on YouTube right now, you can hear my voice and I can train you, all right? And that 45-day dare is a great way to just see and challenge yourself to really do the final thing, is become a member. Being a member with me is a commitment, and it's made for just an elite amount of people. So when I talk about membership here, I really talk about a really elite group of individuals who really understand our core values of God, country, family, and really live by and have really adopted where our motivation inspires them to be better. So I wanted to touch on that, you guys, and really use that so that individuals like yourself who are getting better and inspiring others that understand that, you know what, we do need your support to keep everything going.